Centre swings into fight COVID mode, issues advisory to states over COVID alert. The centre has said make oxygen generation plants functional, conduct regular mock drills at plants, and availability of liquid oxygen at health centres has to be monitored, is what the centre has said. It has said that there should be uninterrupted supply of medical oxygen, and adequate inventory for oxygen cylinders as well is to be kept and maintained. The centre has also said a robust refilling system for oxygen cylinders also has to be ensured. Availability of ventilators, PBPAP systems also needs to be maintained. That is what the centre has said. It is, of course, preparing itself for any sort of eventuality. It doesn't want to be caught off guard at the moment, so it has issued an advisory to states over the COVID alert. It has said make oxygen generation plants functional. My colleague Milan Sharma is joining me live at the moment. Milan, clearly the government doesn't want to leave anything to chance. In case the need arises, we should be better prepared, and that is why the centre has issued this advisory to states.
Well, yes, Polami. In fact, the centre there writing this letter to the states today. In fact, there's going to be a massive mock drill that's going to be undertaken on Tuesday, where preparedness for COVID-19 will be done and undertaken by all state hospitals as well as central government hospitals in a mock drill that requires availability of PSA oxygen plants. We saw in the second wave in Delta variant where there was no oxygen and oxygen was needed by many patients. The hospitals will be assessed on preparedness on COVID-19, assessment of the number of beds with oxygen, without oxygen. And also this particular mock drill that's going to happen is going to check the preparedness in each and every state. So all state health ministers in the meeting that happened with Mansukh Mandviya yesterday have been told to create a system where a synchronized mock drill, a nationwide synchronized mock drill could happen in each and every place to check for the COVID-19 preparedness. Of course, ahead of the fact that the ministry is still assessing international arrivals, and they have also mandated RT-PCR at international arrivals for a few countries, including China, Thailand, Japan, South Korea. Follow me.
That's right, Milan. In fact, that was going to be my next question. So, as far as international arrivals were concerned, because there was a lot of concern around these international passengers who are coming in from countries in the South Asia region itself, where they do get a lot of people coming in from China as well. We have, of course, now decided to go ahead and make RT-PCR mandatory from them, as well as the fact that they're going to be isolated, tested, quarantined if at all they're found to be positive. Give us a sense of the measures that will be taken, Milan.
Well, definitely, Polami. Remember that the ministry was assessing whether or not to implement some kind of restrictions for international passengers who are flying in, not of course directly from China, because there's no direct flight from China to India at the moment, but they're all flying in from countries like Hong Kong, from countries like Singapore, as well as Malaysia. And therefore, there was necessitated that the RT-PCR testing should be made mandatory for a few countries. At the moment, the Health Ministry has confirmed that they have alerted the Civil Aviation Ministry and Airlines to put in place the RT-PCR mandatory testing for people coming from not just China, but Japan, South Korea, Thailand as well. Of course, this happens to be a focused approach for South Asian and Southeast Asian countries more than other countries like the US and Brazil that is also witnessing a surge in cases. So at the moment, only for passengers coming in from these South Asian countries and Southeast Asian countries, of course, is being looked at, but not from countries of US, which is United States, or Brazil, that's also witnessing a big amount of surge in cases because of the B4.7 variant. Follow me.
Right, Milan, thank you so much for joining us with all of those details.